This is the final portion of the endocrine lecture, and we're going to start talking about the adrenal gland. This is from the memory book. It's to remind you of the different things that are produced by the adrenal gland, the 3 S's, sugar, salt, and sex. Your glucocorticoids, which raise your blood sugar, your mineral corticoids, which save sodium, and your androgens, which are your sex hormones. This is normal cortisol secretion. Remember, the hypothalamus secretes corticotropin-releasing factor that stimulates the anterior pituitary to release ACTH, which is adrenal corticotrophic hormone that stimulates the adrenal cortex to secrete cortisol, synthesize and secrete it. So it secretes your mineral corticoids, which is your aldosterone. Remember the end of the renin-angiotensin-aldosterone system. Your glucocorticoids, which is cortisol, and it does a huge amount of things with the cortisol. There is a table on page 211 that talks all about cortisol. We talked about it when we talked about the stress chapter. And there's a figure on page 469 that talks about cortisol. You cannot survive without cortisol. And then you've got your androgens, your estrogens, and your progesterones. So hypercortical function is also called Cushing's, and Cushing's is like you're sitting on a huge cushion of cortisol, so you have way too high level of cortisol. This is due to dysregulation of the hypothalamic or anterior pituitary hormones, so you have autonomous ectopic production of ACTH by a tumor. ACTH is being produced somewhere other than the anterior pituitary. Usually this is due to an oat cell carcinoma of the lung. It can also be iatrogenic, and iatrogenic is oftentimes related to someone who is taking steroids, either legally or otherwise, but it can cause Cushing's. Symptoms are due to the increase in cortisol, and as I said, you need to know the figure on page 469 and the table on page 211. And here's a picture of someone with Cushing's, a drawing on the one side and a picture of a lady on the other side. And there's a picture in your textbook on page 469. And here's another picture of somebody with Cushing's. Osteoporosis. Here's a list of your symptoms. They'll have weight gain. Because from accumulation of adipose tissue in the trunk, the face, and the cervical areas, that gives you your buffalo hump. You'll have glucose intolerance and protein wasting, which will cause muscle weakness, osteoporosis, pathologic fractures, and kyphosis. You'll have loss of collagen, so that will make your skin very thin, very weak. And you'll get purple striae or stretch marks on your trunk with lots of easy bruising. You'll have hyperpigmentation of the mucous membranes, the hair, and the skin. The color will become brown to bronze in color. You'll have increased sensitivity to catecholamines, so that will develop hypertension. You'll have immunosuppression, so that will cause infections. Multiple infections. You'll have electrolyte imbalances, which will cause personality changes. And those personality changes could be anything from irritability to depression to severe psychiatric disturbances. And hyperglycemia will cause glycosuria, hypokalemia, and metabolic alkalosis. Crohn's disease is a problem with an adrenal adenoma or hyperplasia. So as a result, you end up saving sodium and water, having an increased loss of potassium because you have too much aldosterone being secreted. And if it's a secondary form of Crohn's disease, this is primary that you're looking at. Secondary form is due to a problem with your renin angiotensin aldosterone system. Hypersecretion of androgen and estrogen can cause feminization, which is development of female sex characteristics, or virilization, which is development of male sex characteristics. And this is due to overstimulation by ACTH in an attempt to increase cortisol. There's a picture on page 471 that shows virilization. Hypocortisolism is a decrease in cortisol levels. It's called Addison's disease. So you need to add some cortisol. It could be an idiopathic autoimmune disease, which will decrease ACTH production. Symptoms occur when 90% of the gland is destroyed. And the symptoms are due to the loss of cortisol production. This can also be inherited as an autosomal recessive trait. Secondary adrenal insufficiency is due to the exogenous steroid administration, and then you stop giving it. You've all heard, if you don't use it, you lose it. Keep that in mind. And this is looking at Addison's disease, how it works, and the flow sheet that goes with it. And here's a picture of a lady with Addison's from the memory book. And the last piece we're going to discuss in endocrine is a pheochromocytoma. Now, a pheochromocytoma is a highly vascular tumor of the adrenal medulla, and your adrenal medulla is what produces your catecholamines. So you will end up having symptoms of too high a catecholamine level, so that's hypertension, palpitations, tachycardia, headache, constipation, glucose intolerance. If it ruptures, it can lead to hemorrhage. Usually it's unilateral. You'll have an increase in hormone in your catecholamine release if you press on the abdomen, if you have a full bladder, if you have too tight of a seatbelt, anything, if you have sex, anything that puts pressure on the abdomen can cause an increased release of catecholamines. So you need to keep that in mind. These are usually surgically removed, and once they're removed, there's not a problem. As I said, they're unilateral. If it's bilateral, then they have a major, major problem. And we'll be talking about that in 224, I think. This finishes the endocrine lecture.